Hi, welcome to Medicoria. Please support the channel by liking our videos, leaving comments behind, subscribing to the channel, and hitting the notification bell and sharing our videos with all your friends. The initial stages of patient care. In medicine, our goal is to save lives and to improve the quality of lives of our patients. In order to achieve this, we need to approach patient care in a systematic way. It is that systematic approach that I'm going to be sharing with you today in this video. Talking about patient care, what are the stages of patient care that we're talking about here? The very first stage of patient care is creating a good doctor-patient relationship. This is important because you need to obtain a lot of information from the patient, so it's important that you get them comfortable enough to trust you with the information and with their bodies. After you've struck a good patient-doctor relationship, you will need to go ahead and obtain the clinical database. I will be talking about this shortly in the next few slides. After you've obtained your clinical database and having come up with your possible diagnosis, you will then need to go ahead and investigate this patient using the available laboratory tests, immunological studies, medical imaging studies, among others. This is important in order to confirm the diagnosis that you have made clinically. It is also important in determining the prognosis of the patient's condition and for monitoring the progress of any treatment instituted. When you finally made your definitive diagnosis, then you can go ahead and manage the patient. There are different approaches to management depending on the condition. You might manage conservatively using medicines, giving reassurance, or you might perform a surgical procedure and so forth. It is also important to follow up the progress of your patient throughout the course of management. Let's proceed to talk about creating a good patient-doctor relationship. This involves getting your patient comfortable enough to trust you. This is because you're going to be obtaining a lot of information from this patient, and some of it is personal information. Secondly, it is because the consultation might involve examining the body of your patient, so it's important that you get the trust of your patient such that you can obtain accurate information from this patient. In the event that you fail to strike a good patient-doctor relationship, it is likely that you will not obtain all the necessary information needed to make a diagnosis. In fact, if the patient-doctor relationship happens to break down, the consultation should end and the patient should be seen by another healthcare worker with whom they are comfortable. Creating a good patient-doctor relationship begins from the moment you meet the patient. Offer them a warm greeting. Follow this with an introduction of yourself. At this stage, it is important to let the patient know of your title. Try not to complicate the language here because patients usually struggle with understanding the hierarchy of medical positions. It's also important to be honest here, especially if you're a student or a junior health officer or someone who is not experienced. It's okay to tell the patient what level of training you are. At this point, you can also take the patient information, that is the general demographics, the patient name, the age, and other pieces of information. It is also important to show care to your patient. Let them know that you're paying attention to them. Show them compassion and empathy. This will get your patient to relate with you better and to trust you more. You need to make sure that your patient is in a very comfortable environment. Make sure the room is warm enough. Ensure that the patient has privacy. Limit the number of people present in the room during the consultation. It is important that all people that are not necessary for the consultation leave the room. It is also important to face the direction of the patient. However, you need to avoid a full face across arrangement because this can make your patient shy when you look them directly in the eyes. Avoid tendencies of focusing so much on writing or entering the information into a computer terminal. Try as much as possible to show the patient that you're listening. you can keep much of the information in your head and then write it down later. You can then go ahead to obtain your clinical database. This is a very important step of patient care because 80% of your diagnosis will come from this. It is a common mistake to rely on lab tests and other investigations to derive the diagnosis of the patient, but all this can be misleading without a proper history and examination of the patient. There is a common saying that goes, treat the patient and not the lab results. Obtaining the clinical database involves taking clinical history and then performing a physical examination of the patient. It might appear that these two are two separate entities, with clinical history coming first before physical examination, but however, these two are really inseparable. Both history taking and physical examination begin right from the moment that you see the patient. For example, you can examine the facial expression of the patient, their gait as they walk into the consultation room, and other observable features of the patient. It is important to give your patient enough time because, like we said, 80% of your diagnosis will come from this. And also owing to the fact that when you have a good history, you're going to make your investigations as objective as possible and thus making it cost effective. This stage of patient care is very dynamic. This is because medicine is a very dynamic field. There are always new pieces of information, new forms of evidence, new methods, and new techniques of practice. You'll also observe that the process of obtaining the clinical database tends to be very messy, especially if you're a beginner. But this isn't a reason to worry because even the most senior doctors went through the same kind of mess. So your history taking will always get better with practice. So it is important that you keep seeing patients and taking history over and over again, examine patients over and over again, and only then can your skill be refined. You cannot learn this by simply reading about it or watching YouTube videos about it. As the saying goes, to study the phenomena of disease without books is to sail an uncharted sea, while to study books without patients is not to go to sea at all. This statement was made by Sir William Osler, once a professor of medicine. So it is very important that you practice your skills of history taking and physical examination of patients as frequently as you can, because the more you do it, the more you become good at it. Let's dive a little more into history taking. History taking is the process of translating the patient's narrative to medically relevant information. That is to say, you're not going to take every word that the patient says and incorporate it into your history, but you're going to translate the patient's narrative into information that is medically relevant. However, as a student, you're encouraged to preserve as much as possible the patient's own wording of their problem. This is because it is believed that being a beginner, you may not really understand the medical terminologies yourself, so you might actually misuse them. The information about the patient may be obtained directly from the patient, or if there is a language barrier between the patient and the medical practitioner, the information can be obtained through an interpreter. If the patient is unable to give the information by themselves, then some of the information or all of it can be obtained from collateral history. Collateral history is the history obtained from other people, for example, the patient's relative or bystanders that were there as the event happened, or any other individuals that might have information about the patient. This is especially true for children, people with psychiatric disorders, or patients who are unconscious. As you take your clinical history, it's very important to pick up the non-verbal part of the patient's communication. This involves picking up the signs that they make with their hands, their facial expressions, the intonations of their voice, and other non-verbal forms of their communication. It is also important to get as much information as possible on the first consultation. This is because the symptoms tend to get modified as treatment is instituted. Some information can be lost along the course of management because some of the symptoms may no longer be there. Now let's look through briefly an overview of the structure of clinical history. The very first part of the clinical history is the patient information, otherwise known as the demographics. This involves information like the patient's name, the age, the gender, the occupation, their address, and a lot others. Number two is the presenting complaint. This answers the question of what has brought the patient to the hospital. The third part is the history of the presenting complaint. This explores the presenting complaint into greater detail and in a chronological order. The fourth part is the review of other systems. It's because patients will tell you what they feel is important for you to know, but sometimes they can leave out symptoms in other systems that may or may not be related to the condition with which they are presenting. So it is your duty to check through the entire body of the patient through questions to find out if they have any other problems that they haven't mentioned. After this, you can now go on to check the patient's past medical history, the past surgical history, the family and social history. There are other components of clinical history that I haven't mentioned here. Some of them can fit into the above mentioned, whereas others will only come in special situations. For example, if you're taking a pediatric history, there are a lot of other components that you bring into the history. Or if you're taking a gynecologic or obstetric history, there are a lot of other things that you bring in psychiatric history and so forth. I need you to remember that this arrangement of history taking isn't strict. It can always be tailored to suit you as a person. However, if you are a student, it is important that you follow the arrangement that you've been taught, because the people teaching you might strictly want what they've taught you. But once you're out and practicing, then you can tailor this to your own needs. Thank you so much for listening till the end. Please don't forget to like the videos and to leave comments behind. And do subscribe to the channel by clicking on the logo of Medicoria that the arrow is pointing at. See you in the next video.